Good afternoon. I'm Mark Takano, and I have the honor of serving as ranking member of the House Committee on Veterans Affairs. I want to thank all our guests for being here today to discuss the VA's proposed rule to reinstate a near total ban on abortion care. As you'll hear from those speaking today, this extreme rule will be detrimental to veterans' health. We must stop it from being finalized. Time is running out to make your voices heard. The public comment period on this rule closes at 11:59 tonight. Yesterday, Ranking Member Blumenthal and I submitted a comment signed by over 230 of our colleagues demonstrating House and Senate Democrats' staunch opposition to the proposed rule. Just 3 weeks ago, almost to the day, we celebrated VA's interim final rule that for the first time provided veterans access to abortion care in instances of rape, incest, and threat to life or health. It also lifted VA's long-standing gag rule, allowing VA providers to discuss abortion with patients who were experiencing unwanted or high-risk pregnancies and pregnancy complications. In the wake of the Supreme Court's Dobbs decision, the 2022 rule ensured that veterans would still have access to abortion care even if they lived in a state that had banned abortion. Now, the very things that we affirmed 3 years ago, veterans' reproductive freedom, access to comprehensive health care, and a system that trusted veterans to make their own health care decisions, are under attack. This is not progress. It is not freedom. And it is not what veterans deserve. I want to be very clear about the consequences of VA's cruel and short-sighted proposed rule if it is finalized. Veterans will have fewer rights than they do right now. Veterans who walk into a VA medical center expecting to receive the care that they will need will not be able to get it, nor will they even be able to discuss abortion as an option with their providers. VA providers who have the trust of their patients and who want desperately to do the right thing will find themselves in the impossible position of navigating laws that don't allow them to provide the appropriate standard of care. VA claims in its proposed rule that the, quote, threat to life, end quote, exception is enough to protect veterans, but we know that that is not true. If VA's extreme abortion ban goes into effect, pregnant veterans will die waiting for the care they need. We have already seen this happen in states with extreme abortion bans nationwide. People are turned away and refuse the care they need because the law does not allow providers to act until the patient is at death's door. And as those of you here know far too well, when you force someone to wait for care until they are at death's door, you risk that care being too late. We cannot and must not allow VA to force veterans and VA providers into the terrible position of being forced to decide if a veteran is close enough to death to have an abortion. Worse, VA's ignorant decision to remove the threat to health exception in this proposed rule fails to consider veterans' unique health needs and their freedom to make personal health care decisions that are right for them. Veterans have already sacrificed their mental and physical health to serve our country and have a much higher rate of complex health conditions such as post-traumatic stress disorder, severe hypertension, and renal disease, conditions that can increase the risks associated with a pregnancy. Treatments for these conditions can often cause birth defects. Without access to abortion care, women may be forced to cease their own health care treatments to sustain a pregnancy. We have made a solemn promise to honor veterans' service and ensure they receive the health care they have earned. Veterans with service-connected conditions should not be put in the position of being forced to set aside their own health care needs. And yet, this extreme abortion ban would leave veterans without access to care and without options when their very health is at stake. The people gathered here today understand that the health of women veterans matters. Prioritizing their health means that every veteran in every circumstance gets the care, information, and support they need. This proposed rule would allow the government to interfere with healthcare decisions that should be between a veteran and their provider. Veterans fought for our rights. Now it is our responsibility to fight for theirs. We must stand together to stop VA from finalizing this rule. I'm pleased to be joined by many of my colleagues and leaders from organizations who have worked in this space for decades. They are here today to stand against this proposed rule. Thank you for all you do for joining us today. And with that, I want to recognize my friend, Senator Richard Blumenthal, ranking member of the Senate Committee on Veterans Affairs. Senator.
Thank you.